Brian, it's so great to sit down and chat with you today. We've known each other for, I think, about 7 years, and initially met when you were a development manager developing systems in the healthcare space.
Yep.
And today you're serving as a vice president where you're, again, involved in developing applications primarily for hospitals.
Yep.
So anyway, so today I look forward to talking to you about some of your thoughts on what's going on in healthcare IT today.
I appreciate you having me.
Yeah, it's great.
Yeah.
So, since you've been working in healthcare IT for so long, what I'd love to start out is in getting a feel for what you think has been the biggest shift in the industry since you've been involved.
So I think that what we've seen is, at least in terms of the increase in government regulations and moving over from a fee-for-service to more of an outcomes-based payment model, that the accountability of the care has shifted necessarily from the health systems itself, more towards an interest by the consumer themselves in their actual care and their health and wellness, and as such, I think that we've seen an increase in the tools that are going to be necessary in order for the consumer to be a little bit more educated and a little bit more empowered as to how they're going to be taking care of it. And you see a lot of that in some of the wearables, and you see a lot of that in some of the actual applications and tools that are out there today for the end user consumer themselves.
That's a great segue. So I know that this is an area you've been passionate about for a long time, as you and I have gotten to know each other. So I'm so thrilled that that's something you're involved in today.
Yeah.
So talk to me more about that. So how can you describe, what do you think patient-centered care looks like? So talk to me about that. You kind of talked about wearables, but elaborate on that a little bit.
So there's a couple of different ways of looking at it. One is from an actual workflow or operational basis in terms of how does the patient go through their actual episode or episodes of care, and the other one is actually from a pure technology perspective. I think from a technology perspective, we're looking towards I want a turnkey solution for me as a consumer. I want to see it all, and I want to see it right in front of me. And there's bits and pieces of that scattered around, with MyFitnessPal being a really nutrition, diet, fitness centric tool for an end user, and you've got Apple sort of aggregates that data across multiple different sources, but haven't heard a whole lot of noise about it's the ultimate turnkey solution. Ultimately, what we're looking for is I want to be able to have my fitness and my diet, nutrition, and my education, and my there's an app out there called Patients Like Me, so that I can do some information gathering, basically have it all in one central place by which I have ultimate authority as to data coming in and data going out, and really it's about my data at any given time across the entire continuum. The other thing.
Are you talking about unifying the patient data? Is that kind of what you're talking about?
To a certain degree, but it's really not unifying it outside of the patient world itself. It's unifying it within the patient themselves. So a Mint.com, for instance, does all of the financials across your different accounts, your different bank accounts, and some of the trading that you might have and everything, and it consolidates it all into one view, and it gives alerts and stuff like that in a consolidated format. LinkedIn is sort of your business professional centralized repository. There's tools that we're working towards both in the client, the place that I'm at right now, and there's other tools that are coming down the pipe, which are going to be those aggregates across the entire patient. Also, from a workflow, workflow is probably the wrong word to describe it, but from an operational perspective, like how does a patient go through the entire episode of care or episodes of care, that there's got to be more centralization of how that patient interacts with different components of the actual system itself. So you've got your providers that are part of the health system, you've got your payers and your insurance people, you've got care teams potentially, you've got caregivers, and how do they come up with a centralized means by which they're all communicating the same, they're all saying the same thing about that particular patient or patients, populations of patients. So if you're the caregiver for an elderly parent, you can communicate with their particular doctors via the central means. So it's as much operational as it is technology.
So the protection of that data is certainly important. So who, in your opinion, should own the patient data and be accountable for it? And who's going to take that on, I guess?
So it depends on who you ask. I think as sort of the people that are liable and accountable for the care, specifically the health systems themselves, they are in the driver's seat right now, and they own the quote unquote patient record. Payers are responsible for payment, so they obviously hold a lot of financial stake in that whole entire game. Ultimately, I think that the onus is going to be on the patient to start moving some of that accountability and really the ownership of their data, of their patient record, in and around the actual health space itself, and being allowed to be the gatekeeper and the means by which they're able to communicate different points of data across different interested parties.
So does that imply that you think the payer then will be the organization paying for the maintenance of the data from a technology perspective, or who do you think ultimately is going to pay for that data? To keep it maintained? And
so in terms of who's the owner, or who's going to buy the tools by which enables these patients, I think as the person's enabling the actual patients themselves, there's going to be an emphasis on the health system itself. Some of your large IDNs and the health systems themselves are going to be looking towards really fulfilling part of the triple aim. It'll be trying to increase patient satisfaction. It'll be trying to reduce those costs. It'll be trying to improve overall patient outcomes, and that's going to be the burden of that is going to be on the health system in order to get reimbursed. Obviously, these tools will enable those particular patients to increase their satisfaction. It's going to obviously open up the gates from a communication perspective and other technology means by which you're going to be reducing costs and increasing that patient satisfaction.
Okay, so let's talk about, I brought up the idea of protecting the data. So how do you see technology addressing the challenge of keeping that patient identifier and the patient data protected? Can you talk about that a little bit more?
So again, if you look at it in terms of I'm the owner operator of that particular data, I should be the one that's the gatekeeper and the one that's hooking up the data across those two particular systems. So obviously from a very selfish perspective, it's one of those, I know my information from the financial system, and so I'm able to download it and get it into whatever tool repository is necessary, and then I should be able to share that with necessary downstream systems. Likewise, with the healthcare data, I should be able to be the gatekeeper by which I'm sharing that data with other systems. So there's going to be means by which we can go and link together those particular records and share those records across different system or disparate systems themselves. And I, as the patient, am now in control as that gatekeeper across that.
So as the patient, do I need to worry about that data going to the cloud, and how do I know it's safe, or how do I trust that it's safe?
It really depends on the system by which you're interacting with. It's no different from take again a mint.com experience where that data is sitting out in the mint.com servers and warehouse and everything. So technically, I'm already doing that in a financial capacity. Why can't I do that in a health capacity?
Good response. I like that. So I always like to look into the future. I always wish I could see more into the future, but maybe you can. So how do you think technology is going to continue to revolutionize healthcare in the next 3 to 5 years? Any insights or things that you think about?
There's a couple of different things that are interesting to look at right now. And so I think that right now we're experiencing some, we'll just call it growing pains. We're going from a very antiquated old set of healthcare IT tools, and the adoption of the newer tools, the cloud-based systems, the ability to share data, I'll call it seamlessly via FHIR and some of the other HL7 initiatives. I think that there's going to be some adoption pick up there that'll be a little bit slow from both the health systems and the EHR vendors and the payers. So there'll be a little bit of an adoption curve, but I think as we move forward and we see that the technology is really there, that the adoption will start to pick up a little bit. Right now, doctors are still facing a ton of, I'll call it, administrative overhead from the regulations that have come down the pipe from government. Right, wrong, or indifferent as to how you are with the actual regulations, they're here and they're probably here to stay. And so there's a lot of administrative overhead, and some of that needs to be reduced for the doctors themselves in order to be able to have the doctors go back to practicing medicine. Hopefully, with some of the tools and utilities in place in order to be able to have a little bit more open frameworks by which you can share some of this data. Maybe that'll be reduced to a certain degree, so that you're not sitting on the phone calling up and looking for certain records and everything and getting them faxed over to you, which is actually the means by which people are sharing data these days. I think that there's also some really cool, innovative things that are going on in a couple of different spaces. So, whereas wearables are neat, I've got my Fitbit on, yeah, and I feed the data up and I look at it and it's like, oh, cool, that's great data, and I think the question is, now what? You sit there and we've got all these data streams that are coming in, and it's a question of what do you do with the data now that you have it. I've got my nutrition data and I'm tracking my diet. Is it providing anything other than insight or sort of a boost in the right direction to eat better or exercise more? Maybe the real thing is going to be when you start to link those up via insights and some of the big data analytics and being able to really drive some insights into, okay, X is happening, here's Y, potential outcome or potential consequence as to a decrease in some of the trending or an increase in if there's some risk reward types of basis by which you can go and incentivize and get a little bit more skin in the game on the end user consumer themselves. The other thing that's interesting that I'm starting to see pop up is that the wearables have become, I don't want to call it an alert mechanism, but if you start to do some trending, you start to do some analysis on some of the actual wearables themselves, they can be an alert mechanism by which you can send out, hey, you've got an arrhythmia that might be a little bit different from what we're seeing in your normal heart rate or whatever the case may be, and that can be an alert mechanism to a provider or care team. They can go and turn, talk to a patient and say, hey, is there something going on? Preventative care by virtue of wearables would be one of those things. If you're keeping people out of the hospital, you're able to somehow have an alert mechanism by which even your wearables that you're wearing today could reach out and actually have means by which you're preventing that patient from even showing up in the hospital in the first place.
Yeah, I've always been a huge advocate and proponent of, preventative is where it's at, right? If we could just get more people focused on preventing, disease and things, what can we do to change, So I think wearables, if that can help ward off, the guy having a heart attack on the beach, right? Because there have been signs that he was totally oblivious to, but some wearable was detecting that. Wouldn't that be amazing, right?
Correct.
I think so many people have heart disease, they don't even know it, right? Until it's
a little bit too late.
Yeah. So. And
the other thing is that you can start to see some trends in some of the data as to forget about the heart rate and stuff like that. You can start to see some trends in actual data that you can provide an educational means and outreach in that capacity. So as you start to see certain trends in either diet or nutrition or exercise or not exercise, you can actually do an outreach program where you say, hey, have you been eating right, or here's some cooking classes, or whatever the case may be by the health system themselves. And again, it's not a preventative, hey, we're preventing heart attacks, but it could be preventing diabetes, any sort of onset heart attacks and stuff like that. It's really one of those interesting spaces by which people are going to be starting to get into from an analytics perspective.
Yeah, that's exciting. Well, this has been great. I guess this last question we haven't really hit on. Any other obstacles that you think are looming out there that we're dealing with that we haven't talked about today? Anything else in that category you want to talk about?
I don't know necessarily obstacles. I think that we're going to start to see, and maybe this is an obstacle / opportunity. I think that we're going to start to see a lot more uptick in the amount of virtualization of healthcare itself. Telemedicine is obviously on the rise. We're starting to see, again, as you throw the patient in the driver's seat, it shouldn't matter geographically where they are, because technically, they can carry their quote unquote health profile around with them no matter where they are. It doesn't matter if I'm in California or New York. Here's my data. Likewise, doctors should be able to practice across state borders, and that's where sort of the rub is that every single doctor needs to get state licensed for where they're allowed to practice medicine. So how does the doctor in California properly diagnose the patient in Florida?
Traveling in Florida.
Correct. So the virtualization has a little bit of opportunity there for growth, and I think that we're starting to see some we'll call it loosening of the rope, so to speak, around some of that stuff, and how you're going to be able to properly practice medicine across some of those walls. But again, as we're looking towards the next wave, it's being able to do virtualization and getting in front of a quote unquote doctor without actually being in front of a doctor, and taking the brick and mortar buildings out of the equation itself is really going to be the next big wave there. I think that we're already starting to see it, and it's interesting to see where that space is going to go.
Right. There's so many other industries that are already, the brick and mortar has been removed, right?
Right.
Not to talk too much, but banks, how many times you go to the bank anymore, right. Your insurance agent,
yep.
Even to the store, we do so much online, so there's really no reason we can't get medicine there. And medicine is probably the most important, right?
Right.
Getting health care to people that can't get there. The elderly, they can't even drive to get there,
Right.
So been facing that myself as my parents are getting older, so.
Right, and the rub there is going to be, if the patient was in the driver's seat for that particular quote unquote virtual visit, they would need to have the personal health record in their quote unquote back pocket in order to be able to share it with the person on the other end.
Yeah.
You can't do that until the patient is really in the driver's seat.
The data, yeah. Well, that's great. Brings it full circle. This has been very enlightening. I've enjoyed it. Thank you so much for your time. And
I appreciate it.
Maybe we'll get you back again.
Yeah, absolutely. Thanks.
Awesome. Thank you.